Welcome! It's Ashley from Demystifying Your Health. I am so glad that you're here today. In this episode, we're going to be talking about COPD. You've probably heard of it before, but you might not know exactly what it is, or how it's treated, or what you can do to prevent it. So let's find out. COPD is short for chronic obstructive pulmonary disease. And this means that there's chronic inflammation of your lungs causing obstruction of airflow. Obviously, this is a problem, right? We need to be able to breathe in order to survive. And it's usually caused by long-term exposure to some type of irritant. The number one reason is smoking. Whether it's cigarettes, whether it's cigars, whether it's vaping, whatever the case is, our bodies are not designed to handle inhaling these chemicals, and that's what causes this irritation. Other common causes are air pollution, toxic gas exposure, or dust, especially if it's a chemical dust, like if you work in a factory and are exposed to that. So there's two main conditions caused by COPD, and they are emphysema and chronic bronchitis. Emphysema is when the alveoli, which are the air sacs where the actual exchange of oxygen and carbon dioxide take place in our lungs, become damaged because of the long-term exposure to the irritants, which causes them to collapse when you exhale. What this does is it traps air inside your lungs, so you're not getting that full exchange of oxygenation that you need. So that means rather than getting rid of all the carbon dioxide, that's getting stuck and you're not getting enough oxygen in. Obviously, this is a big problem. With chronic bronchitis, the lining of the bronchial tubes, and these are the tubes that connect the alveoli to the outer part of your body, to the outside, essentially. So the lining of these tubes becomes inflamed, causing the area that the air can pass through to become very narrow, which makes it hard for air to flow. And then the chronic bronchitis also results in increased mucus production, which further narrows the openings because obviously when you've got mucus on the inside of the narrowed opening already, it can actually block it off. This is why a lot of people end up coughing. So what are the symptoms of both of these, and are they similar? So let's find out. So the symptoms for chronic bronchitis and emphysema are pretty much the same. You're going to have a cough, and this cough is never really going to go away, and it's going to be there throughout the day. Nothing's really going to make it better. Medicines don't really help. It's going to be there. You're also going to have shortness of breath, and this is especially true with any sort of physical activity, physical exertion, anything that's increasing your body's need for oxygen. You're also going to have wheezing. This is where, because of the mucus blocking off the airway, in some cases, that it makes it hard for the air to flow through, and this actually makes a noise. With this, you're also going to have blue colored to your lips and nails. This is known as cyanosis, and this is due to the fact that you're not getting enough oxygenation to those areas. So you'll have lack of energy. You could have swelling in your lower legs, your ankles, and your feet, because obviously when your lungs are impacted, it's also impacting your heart, and it makes it not work as efficiently. You're going to obviously have increased mucus production, and you will have chest tightness, this feeling like your chest is tight and you just can't take a deep breath. An exacerbation is a sudden worsening of the symptoms. These are common and can last several days. Typically, most people are able to manage these symptoms with the help of their doctor. And then obviously with an exacerbation, usually there's further treatment that's needed, and in some cases it's a medical emergency because the person is so short of breath that they actually can't breathe and they need assistance. And the big thing to keep in mind here is with COPD, it takes years for it to develop because it takes a long time for the damage to occur. This is why it's not usually diagnosed until later in life. And it can cause numerous complications. The number one most common is increased number of upper respiratory infections. Think like sinus infections, colds, anything like that. And this is a problem because these can actually cause an exacerbation because of the fact that your body's just unable to fight it off because it can't get enough oxygen into your lungs. So this is a big concern because it creates this vicious cycle where you get an infection, exacerbates your COPD, but your COPD makes you more likely to have the infection to begin with. So this is why it's important to manage it well, but obviously if you can prevent any of it in the beginning, that would be key. You're also more likely to have colds and flu for the same reason. Your body just can't fight it off as well. and you're more likely to have heart problems, lung cancer, pulmonary hypertension, which is when the arteries in your lungs have higher blood pressure, like too high, it's unsafely high, and then also depression. And this is because people, as their symptoms start to worsen and their conditions get worse over time, this means they're unable to participate in activities that they once could and actually, obviously enjoy doing. So when you're not able to do that, you're more likely to be depressed. So let's take a look now at how everything is treated. So with COPD, unfortunately, there is not a cure. There's no way to make it go away completely. So the whole focus of treatment is managing the symptoms. And it usually really depends on the type, because obviously with emphysema, it's impacting your alveoli and those air sacs and the exchange of oxygen being able to occur there. Versus with chronic bronchitis, you have the narrowing of the lining and the mucus production. So in order to treat those, it requires usually a little bit different approach. Your doctor will help you decide, obviously, once they determine which type you have, which treatment is best for you. Typically, it's going to follow some similar type of course here. You're going to need inhalers, and there's two types of inhalers. You have emergency or the quick-acting inhalers, and these are when you're feeling a sudden onset of shortness of breath, where you feel like you can't breathe. And this often happens with an exacerbation. You're going to use the quick-acting inhalers, and what they're designed to do is to open up your lungs so that way you can get oxygen in. Obviously, they work quickly, but they also wear off quickly. So this is why if you're having to use this, it's still important to seek medical treatment, because most likely you're going to need further treatment in order to prevent your lungs from closing back down again. Maintenance inhalers, on the other hand, are something you take regularly, either once a day, twice a day, whatever is prescribed for that particular inhaler. And these are important because these help reduce chronic inflammation over time, which is key in helping manage your symptoms. So these you need to take regularly just to make sure that obviously you're able to manage your condition. Versus the quick acting, you want to make sure you have those on hand wherever you are. So you need to carry it with you when you leave the house. If you're traveling, you need to have those with you definitely, because in the event of an emergent situation, it needs to be readily available. And there are pills that are more like the maintenance inhalers that help reduce inflammation throughout your entire body. So depending on your other medical conditions, your doctor may decide that you need to take pills in addition to the inhalers. So it's really important to obviously discuss with your doctor all the different possible options. And if you are having an exacerbation, or if you have a cold or something where it's above and beyond your normal symptoms, your doctor may recommend breathing treatments with a nebulizer at home, which obviously you need the machine for that. And then they will give you a prescription for the actual medicine that goes into the little container that you then breathe through. And these are great because it helps to open up your lungs, and they last a little bit longer than the quick acting. And there's different types of the nebulizer medication as well. So your doctor will determine which one that you need, how frequently you need to do it. Usually if you're having to do breathing treatments, it's several times a day until the exacerbation starts to go away. And then as your disease progresses to the point where you're really noticing that you're more short of breath more and more frequently, you're unable to do even simple activities, maybe like get up from the couch and walk to the bathroom without becoming severely short of breath, then your doctor's probably going to recommend home oxygen therapy. And when you're at home, this usually means that you have a big tank somewhere that you have to connect a very long tube to, that way you can walk around and do things. But when you go out and about, you're going to have a little portable tank that you're going to have to carry on your shoulder or something similar to that, so that way your body's getting the oxygen it needs in order for you to be able to function. So as you can see, it really depends on where you're at as far as the disease process, what your doctor thinks best as far as what's going to help treat this particular type of COPD you have. But this is the general sense as far as what you're going to need to do in order to manage your symptoms, so that way obviously you can be as active as possible and participate in the things that you like to do. When it comes to preventing COPD, there are several things to keep in mind, but the number one thing is to not smoke. This is absolutely vital, because this is the most damaging thing that you could do to your body for your lungs, is smoke, whether it's cigarettes, cigars, vaping, any sort of inhaled type of chemical is just not good. Our lungs are not designed to take those in. And then you want to limit your exposure, obviously, to toxic chemicals or gases, and then dust, because for those same reasons, long-term exposure to any sort of irritant just does not bode well for your long-term well-being when it comes to lung health. And then if you already have asthma, it's important to manage this because it places you at an increased risk for developing COPD in the future, especially if it's not well controlled. So if you have asthma, make sure you talk to your doctor to make sure it stays well controlled so you don't end up with COPD in the future, in addition to having asthma. And if you already have COPD, it's very important, obviously, to prevent exacerbations. No one wants to have to deal with feeling like they can't breathe and then end up having to go to the emergency room. So the key things here are you want to manage your symptoms every day. Make sure that they're well controlled. It's similar to when you're trying to control asthma if you have that. You need to be on top of your symptoms. If you notice that things are starting to get a little bit worse, make sure you talk to your doctor. Let them know what's going on so that way they can help you devise a plan that's more effective. And then you want to prevent upper respiratory infections because obviously this can cause exacerbations significantly with those with COPD. So to do this, you want to wash your hands frequently and thoroughly. You want to avoid people who are sick. Obviously, if they're sneezing, coughing, something along those lines, or you know someone's sick, don't be around them. And then you need to get your flu and, if eligible, pneumonia vaccines yearly. Because obviously, if this helps you to prevent from having those, then it obviously prevents your chances of having an exacerbation of your COPD. So by following all these steps, hopefully either you prevent the disease to begin with, or if you have the disease, you can prevent exacerbations. While no one wants COPD, if you have it, at least you know that you can manage it with the help from your doctor. If you don't have it, do everything possible to prevent getting it, so that way you're not having to deal with it. Thank you for joining me today. Hopefully you found the information to be valuable and helpful. If you did, please like, share, subscribe. If you have questions, comments, I'd love to hear from you. Put them below, send me a message, reach out in any format, that'd be awesome. But until next time, stay healthy.